What is a coronavirus? Coronaviruses are an extremely common cause of colds and other upper respiratory infections. These viruses are zoonoses, which means they can infect certain animals and spread from one animal to another. A coronavirus can potentially spread to humans, particularly if certain mutations in the virus occur. Chinese health authorities reported a group of cases of viral pneumonia to the World Health Organization (WHO) in late December 2019. Many of the ill people had contact with a seafood and animal market in Wuhan, a large city in eastern China, though it has since become clear that the virus can spread from person to person. Common symptoms of coronavirus? The symptoms of most coronaviruses are similar to any other upper respiratory infection, including runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus. You could get lab tests, including nose and throat cultures and blood work, to find out whether your cold was caused by a coronavirus. But there's no reason to. The test results wouldn't change how you treat your symptoms, which typically go away in a few days. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe and your lungs, it can cause pneumonia, especially in older people, people with heart disease, or people with the weakened immune systems. How is it treated? Scientists are working hard to understand the virus, and Chinese health authorities have posted its full genome in international databases. Currently, there are no approved antivirals for this particular coronavirus, so treatment is supportive. For the sickest patients with this illness, specialized, aggressive care in an intensive care unit (ICU) can be life-saving. Should you worry about catching this virus? Unless you've been in close contact with someone who has the coronavirus, which right now typically means a traveler from Wuhan, China who actually has the virus, you're likely to be safe. In the US, for example, only 2 cases of the virus have been confirmed so far, although this is likely to change. While we don't yet understand the particulars of how this virus spreads, coronaviruses usually spread through droplets containing large particles that typically can only be suspended in the air for 3 to 6 feet before dissipating. By contrast, measles or varicella chickenpox spread through smaller droplets over much greater distances. Some coronaviruses also have been found in the stool of certain individuals. So it's likely that coughs or sneezes from an infected person may spread the virus. It's too early to say whether another route of transmission, fecal-oral contact, might also spread this particular virus. In the US, the average person is at extremely low risk of catching this novel coronavirus. This winter, in fact, we are much more likely to get influenza B, the flu, than any other virus. 1 in 10 people have influenza each flu season. It's still not too late to get a flu shot, an easy step toward avoiding the flu. If you do get the flu despite having gotten the vaccine, studies show that severe illness, hospitalization, ICU admission, and death are less likely to occur. The bottom line: given the current spread of this virus and the pace and complexity of international travel, the number of cases and deaths will likely to continue to climb. We should not panic, even though we are dealing with a serious and novel pathogen. Public health teams are assembling. Lessons learned from other serious viruses, such as SARS and MERS, will help. As more information becomes available, public health organizations like the Centers for Disease Control (CDC) in the US and the World Health Organization (WHO) will be sharing key information and strategies worldwide. What to do about coronavirus? There is no vaccine for coronavirus. To help prevent a coronavirus infection, do the same things you do to avoid the common cold. 1. Wash your hands thoroughly with soap and warm water or with an alcohol-based hand sanitizer. 2. Keep your hands and fingers away from your eyes, nose, and mouth. 3. Avoid close contact with people who are infected. You treat a coronavirus infection the same way you treat a cold. 1. Get plenty of rest. 2. Drink fluids. 3. Take over-the-counter medicine for a sore throat and fever. But don't give aspirin to children or teens younger than 19, use ibuprofen or acetaminophen instead. A humidifier or steamy shower can also help ease a sore and scratchy throat. Even when a coronavirus causes MERS or SARS in other countries, the kind of coronavirus infection common in the US isn't a serious threat for an otherwise healthy adult. If you get sick, treat your symptoms and contact a doctor if they get worse or don't go away. Thanks for watching. Please subscribe.